I'm Dr. Prasanna Kumar. I'm with Prairie Cardiovascular. I'm an interventional cardiologist. It's very important to realize that there are different kinds of holes in the heart. You know, a hole in the heart does not necessarily mean just one particular condition that is seen in the babies. And in fact, in adults, it's the second most common congenital heart defect. When we are talking about the larger holes or the atrial septal defects, predominantly the blood flows from the left side of the heart to the right side because the left side of the heart has a higher pressure compared to the lower pressure right chambers. So there's constant shunting, what we refer to as blood flowing from one side to another side over a period of time. But because the top chambers are low pressure chambers, you know, many times patients don't really have any symptoms until they get up to age 40. So that's when, they start noticing symptoms of shortness of breath or fatigue or swelling, which are indirect signs of stress on the right side of the heart causing enlargement and increased pressure build up in the lung arteries, that can cause symptoms. So that's more of a symptom of atrial septal defect. Okay. And if you're talking about PFOS or the patent foramen ovale, which are those smaller holes, more like a flap valve kind of holes, they are not big enough to cause these kind of strain on the heart. The situation where PFOs come into play is mostly in patients with stroke. So these are two different varieties of holes, and the directionality of the blood flowing also depends on the type of the hole and the way the hole is behaving, depending on the pressures in the heart.